Hello, my name is Almarely Berríos Negrón. I'm a clinical psychology student from Ponce Health Sciences University, working in collaboration with FDI Clinical Research and Harvard School of Public Health. I will be presenting the research work titled Adverse Childhood Experiences May be Mitigated by Resilience in Mental Health Outcomes Among Adults Living in Puerto Rico. This work was done with Sigrid Mendoza, June O'Neill, José Rodríguez, and Josemier Mattei. Adverse childhood experiences, also known as ACEs, have consistently been associated with an elevated risk of multiple adverse physical and mental health issues. Yet, their contribution to coping ability and resilience in adulthood is unclear. Therefore, we decided to explore if exposure to ACEs implicates higher depression and anxiety symptoms among adults living in Puerto Rico, and if ACEs have a relationship with developed resilience as a protective factor. We used data from 931 participants from 30 to 75 years of age enrolled in the Puerto Rico Observational Study of Psychosocial, Environmental, and Chronic Disease Trends, also known as PROSPECT, an ongoing populational study of chronic diseases. Trained interviewers assessed enrolled individuals using various validated tools for Spanish speakers included in the description. Prior to analysis, we compiled ACE results into 8 distinct domains. One-way analysis of variance or Pearson's chi-square test were used to test for differences in sociodemographic factors with and without ACE. Multivariable logistic regression models were used to evaluate the association between ACEs and depression and anxiety symptoms. After controlling for sociodemographic factors, we included resilience to the model to assess for effect modification. Regarding our results, we will first be looking at the baseline characteristics of participants in the PROSPECT observational study. While looking at the first pie chart, we see that of a total of 931 participants, 62% reported any ACE, while 38% did not. On the second pie chart to the right, considering the total of participants who reported any ACE, we found that 73% of them identified as female and 27% identified as male. On the third pie chart on the lower left, we evaluate the brief resilience scale, and of the total of participants who reported any ACE, almost half of them, 49%, reported normal resilience and 34% high resilience. And on the fourth pie chart, while evaluating mental health outcomes among participants who reported any ACE, we found that 58% reported depressive and anxiety symptoms. Specifically, 34% reported depressive symptoms, while 24% reported anxiety symptoms. Of the participants who did not report any ACE, only 33% reported depressive and anxiety symptoms. Continuing with our results, we evaluated the data using 3 models. Model 1 is unadjusted, Model 2 is adjusted for demographic factors, and Model 3 uses demographic plus the brief resilience score. In Table 1, we can see that adding the resilience score to the model attenuated our findings. The relationship between ACE and depressive symptoms shows no longer significant, yet a significant association with anxiety persists. This may suggest that resiliency seems to play a protective role in depressive symptoms. On Table 2, we noted that there was no clear linear relationship as the number of ACE increased. However, having been exposed to 5 ACEs more than doubled the odds of observing depressive symptoms and more than triple the odds of anxiety symptoms. Finally, on Table 3, we observed that sexual abuse was the most prevalent reported ACE, and having experienced sexual abuse was significantly associated with symptoms of depression. Of the rest of the domains, having an incarcerated household member doubled the odds of having depressive symptoms and nearly tripled the odds of having anxiety symptoms. Also, the household substance abuse domain was significantly associated with symptoms of anxiety. We have found that ACEs do impact mental health outcomes and may be mitigated by resilience. Interventions focused on strengthening individual and systemic resilience should be implemented to improve mental health outcomes in Puerto Rico. These results respond to the Puerto Rico Primary Care Association Network, our collaborators, since these outcomes will assess early trauma in order to provide health centers with trauma-informed healthcare. Hurricane Maria, the southern municipalities impacted by the 2020 earthquakes, as well as the documented rise in child abuse since the onset of COVID-19 pandemic in Puerto Rico, have all accentuated the need to examine adverse childhood events. Our results may be used to inform and implement individual and systemic interventions that attend our populations assess trauma, as well as guide local and public policy in reducing the health impacts that early ACEs have in adulthood. We thank the Primary Health Association of Puerto Rico and our sponsors, the National Heart, Lung, and Blood Institute, and the National Institute on Minority Health and Health Disparities.